Yes. Now it's live now. I think you can see on the top of the left side.
Yes.
Good evening, everyone. Good evening. Most welcome to all the participants. And today is the pre-evening of Women's Day, 7th March 2026. So we are here again after a long time to celebrate the Women's Day with a great renowned woman personality, renowned speaker, Dr. Manjula Kumari ma'am. We are really grateful to have Professor Dr. Himanshu Sharma sir, Principal Gayatri College of Physiotherapy, Udaipur, with us as a chief organizing person for this uh, webinar. And we are really blessed to have the blessing and support of the founding member, the pillar, the mentor of Physio Inculcator, Dr. Harsh Rajiv sir. So, really grateful to you all. Welcome you all for today's session. I heartfelt welcome all the participants for the today's session. I would like to request Harsh Rajdeep sir to please give a brief introduction about the Physio Inculcator, which is one of the partner of this event. Harsh Rajdeep sir, please.
Thank you, Himanshu sir. It's great to see the icons of profession, VV Manjula Kumari madam, all the way from South, our respected Professor Himanshu Sharma sir, joining from Udaipur, the core of Team Physio Inculcators and a very good academician, Dr. Himanshu Sharma from Kota. Physio Inculcators is just a platform of networking and knowledge sharing, and it was started during COVID times. COVID was not good, but everything turns out to be blessing sometimes because of disguise. So that is how this turned out. Till date, the team Physio Inculcators has done international conferences virtually, national workshops physically, hands-on techniques workshops, many in number, and have been fortunate to collaborate with many academic institutes and clinical partners. And in the same lineup, today we are fortunate to have Himanshu Sharma sir as a principal joining from Udaipur representing his institute. Manjula madam, a very great clinician working in the field of non-invasive obesity management and many accolades to her career. Dr. Himanshu from Kota taking on the stage as a moderator. I request the delegates and students who have joined to take full advantage of today's knowledge sharing, because this is a relatively uncommon topic but very useful, and this is turning out to be very relevant as it is being organized on the eve of International Women's Day. So my humble greetings to madam for the Women's Day.
Thank you,
Regards
sir.
to Professor Himanshu sir, and love to Dr. Himanshu Sharma from Kota. Thank you.
Thank you, sir. Thank you so much for your
Thank you,
words
sir.
of
Thank you so
wisdom,
much, sir.
for your blessings always, for the good cause. So now here we are also blessed and fortunate to have Professor Dr. Himanshu Sharma sir, Principal Gayatri College of Physiotherapy. He is having 15 plus years of academic experience, a renowned academician, a very good leader, and a nice mentor. So I would like to welcome you, sir, for a welcome speech. Dr. Himanshu Sharma sir from Udaipur.
Thank you, sir. Thanks for this introduction. Good evening, everyone. I, Professor Dr. Himanshu Sharma, on behalf of Physiotherapy College, Gayatri Swasthya and Shikshan Sansthan Udaipur. It is my great pleasure to welcome you all to the today's session on an important topic, that is reversal of type 2 diabetes on obesity treatment. On behalf of part of Physiotherapy College, Gayatri Swasthya and Shikshan Sansthan, we are truly honored to and thanks to our respected chairman, Mr. Harish Rajani sir, who his continuous guidance and support inspire us to promote health education and clinical excellence. And On the same side, I would also like to extend my heartfelt gratitude to our esteemed speaker, Dr. V.V. Manjula Kumari ma'am, for sharing her valuable knowledge and expertise with us today. Your insight is surely help us to better understand the role of obesity management in reversing type 2 diabetes and improving patients' outcome. Once again, I want to thanks our chairman sir, our respected speaker ma'am, all faculty members and dear students who are joining for today for this event. Thank you all for being here and making this session meaningful. Thank you.
Thank you, sir. Thank you so much for the warm welcome. And we are really grateful for the Gayatri Section Sansthan for giving us the opportunity to collaborate for the knowledge sharing and creating this platform. I'm really fortunate and feel proud to get this opportunity to moderate the session.
I think there is some network issue with Himanshu sir. Am I audible, sir and madam?
Yes, sir.
Is my voice not coming, sir?
Yes,
It
sir.
was
Yes, sir.
interrupted in between. It was interrupted in between, but now it's okay. You can go ahead.
So this gives me really immense pleasure and matter of proud to moderate the session today with our renowned personality, Dr. V.V. Manjula Kumari ma'am. Manjula ma'am is a very famous name in the field of physiotherapy. She has numerous awards and achievements with their name. She is having more than 20 years of
Yeah,
experience in
right
physiotherapy.
now everyone is audible.
She is having numerous awards and achievements and having a long experience.
Himanshu Sharma sir, are you there with us? Himanshu Sharma sir from
Yes, sir.
Yes,
Kota.
sir. Yes, sir. Yes, sir. Am I audible, sir?
Yes, sir.
You're audible. I think there is some technical glitch at your end.
Oh, okay. I'm sorry. So,
Kindly continue.
so
Kindly continue.
yes. So just to confine my words, there are no, I have no such words to express my gratitude towards Dr. Manjula Kumari ma'am for sparing their precious time. And she is the very renowned face in the field of physiotherapy for creating awareness, for doing excellent physiotherapy services, for the betterment of the health of patients, and a renowned researcher in the field of physiotherapy. She is one of the least physiotherapists who has got the fellowship from Royal College of Medicine and many other international authorities. Getting a fellowship itself represent about the value of the work dedicated by Manjula Kumari ma'am for the promotion of health and promotion of physiotherapy. The profession grows because of the professionals like Manjula Kumari ma'am. We are really proud to have you on the board with us, ma'am. And the topic of today is the non-invasive reversal of diabetes via obesity management. So itself says a lot about the theme and the motive, and we are really confident and blessed to have an excellent and eminent speaker with us. All the stage goes to you, ma'am. Most welcome to you.
Thank you so much for the wonderful words, sir. Thank you so much, Harsh, sir. Himanshu Sharma, sir, Kotawala, and Himanshu Sharma, sir, Gayatri College. Thank you so much for inviting me. And our association is like, it's been from COVID times. I have done a webinar with you for Physio Inculcators as well. Since then, we have been doing all these webinars. I'm very happy to share the stage as well as share my knowledge to all the audience here. I'm so happy to be here. And shall I start the presentation, sir?
Yes, ma'am. You can start screen sharing and you can start the presentation. Then we will go on the backstage.
Yes, sir.
The participants are really excited to attend the session, and I can see the curiosity and attentiveness of the participants. I think many of them are already there online, awaiting, I think, before the time of the session. If you have any query, you can write down in the chat box as in the comment section of the YouTube. We will definitely take care all the questions at the end of the session. Keep enjoying. Yes, ma'am. Your screen is there.
Yes, sir. A very good evening to one and all who is listening to this lecture. I'm honored to be here. I'm Dr. V.V. Manjula Kumari, Senior Consultant Physiotherapist and CEO of Varna's Healthcare Research and Training Organization, India. I'm honored to be the speaker in this webinar organized by Gayatri College and Physio Inculcators in association with both these institutions and organizations is quite a long, and I'm very happy to be here. Today, I'm going to talk about a reversal of type 2 diabetes mellitus with obesity treatments. You must be wondering, is it really possible? Is it really possible to reverse type 2 diabetes mellitus with obesity treatments? Yes, it is possible. So in this webinar, we are going to discuss how it is possible and what should be done. Diabetes mellitus can be reversed by two things like, significant weight loss and lifestyle modification, including healthy diet. These things, significant weight loss will reduce the burden on the liver and pancreas. The excess fat deposition in the liver and pancreas creates, insulin resistance will be created by this particular excess fat deposition in the liver and pancreas. When these things are removed, the excess fat deposition is removed, then it would be easy for them to perform normally, and the reversal of diabetes will be easy. Here we are going to see what are all the things associated with this. This is my introduction slide. So with this, we are starting the session. So I just want to go very brief about this, as all the audience know that, all the viewers know that definition of obesity can be defined as an excessive amount of body fat, which increases the risk of medical illness and premature death, which is just nothing but increases the risk of morbidity and mortality. Recently, WHO proposed guidelines for classifying weight status by body mass index, which is nothing but BMI. Though we have other scales for obesity, something like BMI, skin fold method. We use the calipers to see the skin fold, and other methods are also available. BMI is taken as the standard for measuring the obesity. But when it comes to the bulkier persons like Arnold, we have to take care of other things also. So BMI will not be taken as the scale of assessment of obesity. So in that case, we'll be going for bioelectrical impedance analysis methods, and other methods will be more beneficial. So for common population or general population, this is the BMI is taken as the assessment scale. The internationally accepted classification of BMI in adults is less than 18.5 is considered to be underweight. 18.5 to 24.9 is considered to be normal weight. 25 to 29.9 is overweight, and 30 to 34.9 is class 1 obesity. 35 to 39.9 is class 2 obesity. Anything more than 40 is considered to be morbidly obese. But this is for international population. When it comes to the Asian population, this scale is a little different. Less than 17.5 is considered to be underweight, and 17.5 to 22.9 is considered as normal weight. Anything 23 to 27.9 is considered as overweight. Anything above 28 is considered as obesity in Asian population. As Indians, we come under the Asian population. The other scale has to be followed. So what are the causes of obesity? Obesity has two kinds of causes, individual factors as well as the environmental factors. The individual factors include cognition and addiction, genetics and epigenetics, nutrition, hormones and metabolism, the BMR rate, exercise and activity levels, how if the patient is sedentary, or how about their exercise and physical activity, what is their daily routine, everything contributes to obesity. Sleep, stress, and immunity also. How stress influences a person's body weight is like the hormones which regulate the hunger as well as the satiety. The hunger hormone is called ghrelin hormone, which is secreted more when a person is stressed. That creates the more hunger, and binging will be more. And excess calorie intake will be more when you are stressed out. So the stress, sleep, and immunity, all these factors contribute to obesity or overweight. And the external factors include education system, parenting, workplace and business culture, community and lifestyle planning, food policy and production, healthcare and policy delivery, finances and funding. All these things contribute to the obesity or overweight. So with this introduction, we are going ahead with, how obesity is present worldwide. This is the way 3.4 million deaths are caused by overweight and obesity. We all know the fact that obesity is the modifiable risk factor which can be modified. Even if it is genetic, it can be modified. External and internal factors, whatever is contributing to obesity, it can be modified. This is the best risk factor that can be modified, and this is the risk factor which is contributing to the other risk factors such as hyperlipidemia and diabetes mellitus, and also to the hypertension. So if we can modify this obesity or overweight in the overweight stage itself, our longevity will be more, and the quality of life will always be more, and we can lead a healthy and successful life. So obesity control is far most important for each and every individual. Nowadays, sedentary sedentary things are happening, like people are most of the people are sedentary because of their work, or most of the desktop workers like software engineers or someone, or like even the students are sedentary nowadays. So obesity is more in the childhood obesity is also more in student population, even in the school going kids, like preschool, I mean, like not preschool, like 6th, 7th grades onwards, the obesity is more because of they are being trapped in the concrete buildings, and they are not allowed to play, and the work stress is more, the study stress is more. Everything is contributing to the childhood obesity as well. If a child is obese, and if they don't consider that controlling of obesity, they'll grow up into obese adult. Obese adults, again, they grow up into the obesity continues. They have to check at some point. So if they're not checking that, obesity obviously leads to diabetes, type 2 diabetes. And what is diabetes mellitus? We all know that it is a metabolic disorder characterized by hyperglycemia, high blood sugar level, due to an absolute or relative lack of insulin, or to a cellular resistance to insulin. There are two major classifications in diabetes mellitus, that is type 1 diabetes and type 2 diabetes. So this is type 1 diabetes and type 2 diabetes. Type 1 diabetes, as we all know, it is insulin dependent, whereas the type 2 diabetes is non-insulin dependent. Non-insulin dependent diabetes, and it is adult onset diabetes. Type 2 diabetes always we see type 2 diabetes in 40 plus individuals. Nowadays, the line is a little lower. Even in 35 plus years also, we are seeing the type 2 diabetes. But in normal, it is considered as 40 plus or so. But the type 1 diabetes, we see it is also called as juvenile diabetes, childhood diabetes. So now we are talking about only the type 2 diabetes. So type 2 diabetes, how we can reverse that using the obesity treatments. I'm giving a very brief thing about diabetes and obesity, as everybody knows that. So these are the types of diabetes, as I mentioned. In type 2 diabetes, body cannot use insulin properly, which is nothing but insulin resistance. Can develop at any age. Most cases can be prevented. Type 2 diabetes cases can be prevented. In adults, type 2 diabetes accounts for approximately 95% of all diagnosed cases of diabetes. So, risk factors for type 2 diabetes is unhealthy diet, 1 in 3 is overweight, and physical inactivity causing 1 in 10 are obese. As I said, physical inactivity, sedentary lifestyle is leading to obesity, and obesity in turn leading to diabetes. So, key actions for everyone is eat healthy, be physically active, avoid excess weight gain, check blood glucose if in doubt, and follow medical advice. These are the things which we have to follow. Definitely we have to follow if we feel like we are in the risk of getting diabetes. And now coming to effects of obesity and diabetes on general health and offering resistance to infections. How the obesity and diabetes is going to affect the general health of the individual. In COVID, during COVID season, COVID lockdown and COVID crisis, we have seen that obese patients were very much prone to infections, and treating them was also very hectic thing, and most of them resulted in ICU, and most of the morbidity and mortality occurred in diabetes patients and obese patients. So in this, obesity is now recognized as a chronic or a non-communicable disease. Recent research has clarified the physiology of weight regulation, the pathophysiology that leads to unwanted weight gain and maintenance of the obese stage, even when reasonable attempts in lifestyle improvement are made. And the adverse health consequences of generalized and central obesity. Central obesity is the main culprit. So one should always focus on this central obesity. While more sensitive and specific imaging methods to quantify body composition are available, most office-based practitioners like a physiotherapist will need measure only height, weight, and waist circumference. The height, weight are measured for BMI calculation, and the waist circumference is also taken. With these, a patient's risk to obesity-related comorbidities such as type 2 diabetes mellitus and cardiovascular diseases can be estimated, and appropriate treatment plans and goals can be planned. So, what are all the comorbidities associated with obesity, like this respiratory dysfunction, impaired respiratory mechanisms, increased airway resistance? We see sleep apnea is also there because of obesity. Comorbidities such as cardiovascular disease, diabetes mellitus, and kidney diseases are also there. Metabolic risks such as hypertension, pre-diabetes, insulin resistance, and dyslipidemia. All these things are caused because of obesity. In severe course of COVID also, this has resulted in lot of morbidity and mortality also. So this is the early data on COVID-19 and obesity, how obesity affected the treatment of COVID-19 patients. So this is the biological basis for the obesity COVID-19 link. These are the challenges in the management of patients with obesity who became ill and require intensive care. More difficult to intubate the patients with obesity, more challenging to obtain diagnostic imaging. Patients are more difficult to position and transport by the nursing staff. All these things happened during COVID. This particular slide and this particular data has been collected just to show how obesity is affecting the treatment pattern, or how this is going to cause the infections, and how it is going to worsen the condition of the patient. So diabetes and risks from COVID-19. Even the diabetic people, they had faced a lot of risks during COVID infection. People with the diabetes appear to be at increased risk of having more severe COVID-19 infection, though evidence quantifying the increased risk is certainly highly uncertain. So why I have chosen this COVID-19 infection is we have the data present only for this COVID-19 infections. Other data for other infections, we don't have the clear data. So this is the example how diabetes and obesity are, you know, posing a risk for infection, and in the treatment pattern also they are delaying the healing process. So one should be aware that diabetes and obesity should be controlled to lead a healthy and happy life without any morbidities, or to decrease the risk of mortality as well. So coming to pre-diabetes. What is pre-diabetes? Pre-diabetes is when a person's blood sugars are higher than normal but not high enough for that person to be diagnosed with diabetes. Like pre-diabetes condition is a condition where the person is about to get the diabetes, he has high chances of getting diabetes, but he has not yet diagnosed with diabetes. So in this condition, if that particular person is obese, and if that particular person focuses on weight loss, he can push few years away. They can postpone this diabetic conditions and all. Pre-diabetes is the best phase when we can focus on a person to lose weight, and we can actually give him the most healthy and happy life. A quality life can be given to any individual who is 45 plus. This pre-diabetic condition is most common in 45 plus individuals. So we have to take care of each and every individual based on their age, because age is also a risk factor for ill health. So when a person is 45 years age, they have to go for regular health checkups. So blood work has to be done as and when necessary. And when they has the when they feel that, when the medical practitioner feels that they have the risk of getting diabetes, that is in the pre-diabetic condition, they have to change their lifestyle, and the lifestyle modification has a great effect on their healthy living. Like common risk factors, as I said, 45 plus, genetic representation of diabetes, and the risk increases with a high blood pressure as well. Not enough exercise has been done. All these things contribute to diabetic stage. So in the pre-diabetic stage itself, if we can control our diet, and if we go for lifestyle modification and everything, these conditions can be prevented as well as maintained properly. So what is healthy lifestyle exactly? Everybody says that we know this, but none follows this. One who is committed to healthy lifestyle only can get the health benefits. Even in reversal of diabetes, losing significant amount of body weight, increasing the physical activity, healthy diet, and lifestyle modification, all these four things play a major role in the reversal of diabetes. Unless until a person is committed for lifestyle modification, nothing would work. Even if they are going to go for a surgery, or even if they are going to go for some medications, or they are going for any non-surgical procedures such as cavilipolysis, cryolipolysis, or and other non-surgical protocols also, nothing will be useful unless they are committed to healthy lifestyle, unless they are committed to lifestyle modification. The lifestyle modification includes healthy diet with less amount of carbs, more amount of protein, and more amount of fiber. All these things are very important. Why healthy diet is important and how it contributes to the weight loss will be discussed in the following sessions. Why healthy physical activity level? What amount of physical activity level has to be taken up, and how many times they have to continue, what kind of exercises should be followed, everything will be discussed right now. And ideal body weight should be maintained, as I said, 18.5 to 24.9 in the international population. In Asian population, it is 17.5 to 22.9 would be the appropriate range of BMI. Smoking has to be, you know, smoking has to be stopped, and moderation of alcohol intake should always be practiced. All these things should be practiced unless until this house lifestyle, healthy lifestyle modification has been accepted and followed by the patient. Diabetic reversal will not be possible, and obesity treatments will not be possible. Losing excess weight will not be possible. Now, how fat deposition is related to diabetes? Till now, we got to know what is obesity, what is diabetes, what are the contributing factors, and how we can manage that. In the sense, how we can practice the healthy lifestyle and other things. Now, how exactly the fat deposition is related to diabetes? Studies say that the increase in visceral fat increases the risk of insulin resistance more in humans, whereas the excess subcutaneous fat deposited mitigates increased risk of insulin resistance, which in turn leads to type 2 diabetes mellitus. Not only the visceral fat, the subcutaneous fat deposited also increases the risk of insulin resistance. Subcutaneous belly fat, especially subcutaneous belly fat, contributes more to the insulin resistance when compared to the subcutaneous fat in the lower body. So one should always focus on reducing the subcutaneous belly fat along with the central obesity. So one should focus, if a person has a subcutaneous belly fat, more visceral fat, and the central obesity, they have the more risk of getting this diabetes. So this has to be addressed properly. So this is a study done by scientists in UK. How losing weight can reverse diabetes. They have followed a stepwise program, 3-step program. Type 2 diabetes is caused by excess fat in liver and pancreas, as we discussed. Drastic loss of weight reduces fat in pancreas and helps remit the disease. This is what these experts say. This is the study done by UK scientists. They have given a 3-step program. In the step 1, low calorie formula diet, 825 to 853 calories has been given daily for 3 to 5 months. In this particular study, they deducted, this study has been conducted between 25th July 2014 to August 5th 2017 among 298 people aged between 20 to 65 years of age and diagnosed with the disease in the past 6 years. As we discussed in the first session, slide itself, most recently are with the shortest duration of diabetes, diagnosed with diabetes is the best candidate, is the ideal candidate for this reversal of diabetes program. So in this particular study, they have selected the people who has been diagnosed within the past 6 years. 149 members out of 298 people were put on weight management program. Anti-diabetic and blood pressure lowering drugs were all stopped at the start of it. The rest continued with the best practice care, including medication. Out of 298, 149 were put on weight management program. For them, anti-diabetic and blood pressure lowering drugs were all stopped. To the rest of the people, they continued with the best practice care, including medication. That is, they have used anti-diabetic medication as well as the blood pressure lowering medication. The people who, these 149 people who were put on weight management program were given this 3-step program. Step 1, that is low calorie formula diet, 825 to 853 calories daily for 3 to 5 months has been given. In step 2, stepped food introduction, Slowly, they have started introducing normal foods, that is between 2 to 8 weeks. In step 3, ongoing support for weight loss maintenance with strategies to increase physical activity has been given. In this study, they have focused more on the healthy diet management. And in the last step, they have given the increased physical activity. So after an year, 46% of participants who lost weight significantly did not have diabetes, the highest in those who lost over 15 kgs. So this study and a few more studies suggest that weight loss, that is from 10 to 15 kgs, has significantly reduced the risk of diabetes and significantly helped in the reversal of the diabetes. So we have to focus on 10 to 15% of a weight loss in a diabetic patient if he wants the reversal of diabetes. So this is the mark which we have to reach while we are treating a patient for diabetic reversal, while we are treating a obese patient for diabetic reversal. So how to manage obesity? The first thing is diet, as suggested in the earlier study. Modified exercises. Why modified exercises? If a person weighing around 100 kgs is our patient, and we cannot ask that 100 kgs patient to run around or to go for a jog or something else, to go for staircase climbing and other things. You know why? For every 1 kg excess weight, there will be around 4 times more weight, more pressure on the weight bearing joints. Head, arm, trunk weight has to be taken care by the weight bearing joints. So when a person is even if the person is 1 kg more than what he has to be, what he is supposed to be, that creates around 4 kgs excess weight on each of the weight bearing joint, each of the knee, and that causes the wear and tear in the cartilage and resulting in the osteoarthritis and other things. So when we cannot ask a 100 kgs person, already his weight bearing joints are under risk. We cannot ask a 100 kgs person to go for squats or deadlifts. Already the knees and other weight bearing joints are under pressure. We cannot ask them to do that. So what we have to do? We have to give them some modified exercises. Modified exercises as in partial weight bearing or non-weight bearing exercises or isometrics, wall isometrics, something like that we have to plan. Non-weight bearing exercises in the sense bicycle, ergometer, we can give them. Swimming, we can suggest. Certain other modified exercises we can suggest. So that way we can increase the physical activity. Then coming to the supportive non-surgical treatment such as EMS. This is EMS is nothing but electrical muscle stimulation, where we will be stimulating the neuromuscular junction, which creates more contractions in the muscle. Thereby the glycogen, everything can be absorbed. Thereby, we are giving some weight loss. Cavi lipolysis. Cavi lipolysis is the modality which uses ultrasonic energy and targets the lipocytes. These lipocytes in that particular treatment area will be broken down and carried to the lymphatic system, where in the liver, through lymphatic system to the liver, where the liver assimilates everything, and then the fat will be removed from that place. But when the fat is deposited in the liver or in the fatty liver condition, cavi lipolysis is not the modality which we can use. So we should not use this cavi lipolysis for already stressed livers, or for already fatty liver. We cannot use this cavi lipolysis. We can go ahead with the cryolipolysis. Sorry. In cryolipolysis, we will be freezing the fat to -4 degrees, where the fat cells are broken down. In fact, the fat cells die, and through apoptosis process, that particular area will be shrinking. These broken fat cells will be carried away by the scavenging activity of the lymphocytes over there, and in that particular area, the fat deposition will be cleared, as well as the skin will be tightened. Everything will be achieved. Like in cryolipolysis, this fat, broken down fat, the dead fat will be taken away by the scavenging activity of the lymphocytes, but they will not be carried to liver or any other organ. So they will not be stressing up any other organ. So this is the best practice in people with the obese, in obese patients who has the risk of um, fatty liver or already fatty liver is present. Laser lipolysis will be using the laser to break down the fat. So with all these things, lymphatic drainage is very important. Lymphatic drainage should be given to the patients so that that drainage will carry away all the dead debris from the treatment area and gives the desired results. Mesolipolysis is also given. Along with that, surgical management of obesity is also present. So bariatric surgery is considered to be the surgery which, weight loss surgery, where in the earlier days they used to use the rings and other things, gastric bypass and other things. A person can be posted to bariatric surgery only when a physio certifies that this particular patient cannot lose the weight by all non-surgical methods or physical activity or diet or other things, then only that particular person can be posted to a bariatric surgery. And liposuction for fat loss. Liposuction is not a weight loss procedure. It gives a segmental fat loss, not weight loss, but segmental fat loss. This might be useful in few of the patients. So this is mentioned over here. So next line of treatment is medical management of obesity. Everybody is going crazy on these injections, Mounjaro, Ozempic, Wegovy and other weight loss pills. One should remember these injections should be used only by prescription, only when prescribed, and these injections should be used under the supervision of an endocrinologist or a physician. I have seen lot of patients using these drugs without any prescription. I have seen a case in last week itself. I've seen a person who has been joined in the hospital because of the hypoglycemia. When I asked him, why you got this hypoglycemia, or you're not diabetic, then I got to know that he used Mounjaro 7.5 mg without any prescription, which he got from some medical shop or some pharmacy. So immediately, what is the dosage and how it should be administered? It has to be decided by the endocrinologist or the physician. It is not an OTC drug. Your social media celebrities, influencers and celebrities, they are not your doctors. One should understand the pros and cons of Mounjaro, Ozempic and Wegovy. Your doctor will be the best person to advise the dosage as well as how to administer. There are a lot of things included in this particular dosage pattern. They will be giving you the micro dosages at the starting, or before stopping these drugs. They might be advising you to go for microdosing. They might be giving you, they might be starting with the 2.5 mg, then they might proceed to 12.5 mg, and then again they can taper the doses. That all decided by the endocrinologist and physician. I request everybody, please don't take it as a OTC, over the counter drug. It is not an over the counter drug, and it is not the first line drug for obesity. It is the drug designed for diabetes. If you are using exclusively for obesity, please do it under the supervision, and you please understand the pros and cons. And if you are using it under prescription from the doctor, then he will be deciding the dosage which you are using for the diabetes or which you are using for the obesity, and he is the person who is going to decide. A qualified doctor might prescribe these medicines only when the pros outweigh the cons of using this medication. One should not play with their own health. This is what is important, really important. Self-prescription medications and dosages are always harmful, and Google medications are always harmful. Certain things which are useful to some other people might not be suitable for you. So your doctor will be knowing much better and he will be advising. And it is a humble request that it is not an OTC drug. Please don't use it. So now, I told you that a healthy diet plays a major role, and it is the one which it is a key factor which is going to control diabetes. So how exactly we can understand the cravings, control of food intake, how we can control the food intake. So this is the energy balance, energy expenditure and intake. Energy intake and expenditure should always be in a balance. If the expenditure is more, you will be losing weight. If the intake is more, you will be gaining weight. So this is a balance. When the expenditure is exactly is equal to intake, you will be maintaining your weight. So what is this? Ghrelin, insulin, leptin. Ghrelin is the hunger hormone which is secreted in the stomach. This signals your brain saying that I am hungry. It's the time for it is the time to have food. And insulin, insulin is secreted in the pancreas, as we all know. And insulin, it makes the energy available to each and every cell. And adipose tissue secretes leptin. Leptin is the satiety hormone. It says that it signals the brain saying that enough, I have got the enough energy. Now you stop feeding. I don't need any food anymore. So this is the leptin is the hormone which says satiety, I'm full, I don't need any food. These things should be kept in mind. And now, this is the mechanism. Your brain, ghrelin signals your brain and says that the gut produces ghrelin to let your brain know that you are hungry. After eating, the food is digested through the intestines, it reaches incretin, and the pancreas will be stimulated where it will be secreting insulin. Insulin makes the food available to the cell, and from there the adipose tissue secretes leptin saying that feeling full. This is a mechanism, and this should be, you know, perfectly balanced. When a person is stressed, the ghrelin hormone releases more and binging will be more. That is the reason why whenever we are stressed up, we feel like eating more junk food. We binge on food. So stress should be kept at bay. We have to know how to maintain our stress so that the ghrelin hormone will be it will be in the normal range. And there is a simple thing which we can hack the ghrelin hormones. Eat more amount of fiber. Fiber acts as a biohacker for ghrelin hormone, which gives the feeling of fullness, and the ghrelin hormone will not be released for longer times. That is the reason whenever somebody is trying to lose weight, we advise them to go for high fiber diet. So that actually biohacks ghrelin and helps us from and that actually prevents us from going for binging. So ghrelin hormone is very important. Whenever you are stressed up, it is released more. And if you want to, biohack ghrelin hormone, we need to have more amount of fibrous food. Fiber is very important. So after this, after prescribing the healthy diet, the diet which has to be more in protein and it should have all the nutritional values, essential amino acids, everything should be there, low in carbs and low in fat. As we all know, this is called the healthy diet, and our diet should always be rich in fiber to biohack the ghrelin, and the leptin mechanism will always be more. And here we have to understand one thing. In this ghrelin leptin mechanism, if a person goes for a moderate to high amount of exercise, the leptin resistance might be there. So, which also causes high, hunger pranks will be more, and the person will be consuming more amount of food. That is the reason why we prescribe the patient to go for mild to moderate exercise so that the leptin resistance will not be there and the person will be able to lose the weight. So that is modification of exercise, and exercise prescription will also be, as I said, we have to consider the head, arm, trunk weight, which is being earned by the weight bearing joints. Preserving the weight bearing joints, we have to give them the exercise protocol. Based on that, strength training exercises, as I said, use the body weight against gravity, bands, and minimal weights, not more than 10 kgs, not more than 5 kgs in the initial stages, very minimal weight. And then balancing exercises. Why do we need balancing exercises and posture awareness exercises in obese people? Posture awareness exercise is very important. When the belly fat is more, the lordosis will be more, the lordotic curve will be more, low backache will be more. So all these things will be more. So posture awareness and posture training is important. Balance exercises is also important because of knee pains and all. They might be using, they might be standing on single leg more, the unaffected leg more. So all these things should be corrected. Aerobic physical activity, as I said, non-weight bearing like a bicycle ergometer or swimming or something can be given in bouts of 10 minutes or more, moderate to vigorous intensity. That too non-weight bearing. In non-weight bearing itself we can give them. Weight bearing exercises should be taken up only after the person or only after the obese patient loses 10 to 15 kgs of weight. Then only with the gradual weight loss we can proceed to weight bearing exercises. When the person is 100 kgs or say 20 kgs more weight, more excess weight than what he is supposed to be, we cannot prescribe them weight bearing exercises. Or if strenuous activity or weights deadlifts cannot be advised. So taking into consideration all these things, we have to prescribe a exercise program for them, and with that we can slowly progress to strength training as well. So this is the FITT formula for obese patients with diabetes. So for them, in our clinic, we give them aerobic exercises 3 to 5 times a week. And the heart rate should be like, we'll be giving them only 60 to 70% rise of heart rate in the initial stages. Later, we will be progressing. And this aerobic exercises is also given for 10 to 15 minutes in the initial stages. Later, it can be progressed to 15 to 30 minutes. As I said, mild to moderate exercise is given to them to prevent the leptin resistance. So after that, initially we'll be planning more aerobic activity, then flexibility. Later stages we will be proceeding towards muscular strength, that is strength training. So these are the benefits of fitness target zones and heart rate zones. As I said, 60 to 70% burn fat and calories. So we will be focusing on that particular range, that intensity level. The maximum heart rate the heart rate percentage should be 60 to 70%. The intensity level is decided there in the initial stages. Later on, when the patient progresses, then we can go ahead with the advanced ones like 70 to 80, and we cannot go beyond 90% because we are not going to train them for athletics. If they want us, if their body supports, then we can go for that. Being a physiotherapist, we should know the maximum range and the maximum intensity level. Based on the patient's condition, we will be deciding that. So we did a clinical study in our clinic, the effect of non-surgical obesity treatments on the type 2 diabetes. It's a clinical study done in our clinic, and I'm going to show what are all the treatment protocols we have given to the patient, as well as we have used biomedical bio impedance analysis machine, that is Tanita, to decide the BMI as well as the body fat analysis, subcutaneous fat as well as visceral fat. Everything has been taken into consideration. So these are the materials and methodology we have used. Study design is experimental study. Sampling technique is convenient random sampling. We have taken around 200 obese patients, 100 in each group. The duration of the study was 1 year. The source of data, the study has been done at Varna's Healthcare Research and Training Organization, which is my organization, outpatient department, and the subjects were considered for this study only after they signed an approved consent form. An approved consent has been taken from the patients, and then they have been asked to join this study. They were considered to this study. The inclusion criteria being age group is around 35 to 40 years of age, gender, both male and female patients were recruited. Diabetic and obese patients ranging from BMI more than 25 kg per meter square to 35 kg, 35 BMI has been selected. As Asian population has low muscle mass, BMI, which is more than 25 kg per meter square, is considered to be obese, as I said. And without serious obesity related comorbidities has been selected. The exclusion criteria being patients with other mental disorders such as schizophrenia, epileptic patients, active inflammations, cancer patients due to the risk of metastasis has been excluded, and DVT due to the risk of pulmonary embolism and other issues. These are the patients who were excluded from our study. Recent fractures and on steroid drugs are excluded from the study as well. So this is the methodology. 200 obese patients ranging from BMI, as I said, 25 to 35 without serious obesity related comorbidities and diabetic under medication were randomly placed into two groups. So in the earlier study, they used only diet. In our study, we used non-surgical obesity physiotherapy modalities like EMS and other things we have used, and we have done this study. Group A was a controlled group with 100 patients. The diet and lifestyle modification, which includes behavioral therapy, stress management by yoga and meditation, and balanced diet rich in fiber and protein are given. Group B was the experimental group. That is 100 individuals have been recruited in this comprehensive approach in conservative management of obesity, which includes diet, lifestyle modification along with the non-surgical, non-invasive slimming treatments and electrotherapeutic modalities like a neuromuscular electric stimulator for stimulating the motor end plate, thereby making the muscle fibers to contract more, as I said earlier, by which energy expenditure is done, and also which in turns which actually works for weight loss, along with cryolipolysis. This was already mentioned, like we freeze the fat to -4 degrees Celsius, where the fat cells actually die, and that particular dead fat cells have been taken out from that particular area as phagocytosis, and that particular area is tightened by the same way as the tadpole loses its tail before becoming a frog, that is apoptosis process. In that process, that particular area has been tightened up. So cryolipolysis treatments were also given to that particular patient. This is the neuromuscular junction, stimulation of neuromuscular junction, motor end plate. This is how it happens. This is the neuromuscular electrical stimulation, and this is cryolipolysis, freezing the fat. So these are all the things which happen. As I said, apoptosis process is also mentioned here. So these two treatments were used, and these are the results of which actually happened in those patients. So non-surgical body contouring in this, this actually improves the body, reduces the double chin, tightens lax skin, decreases the subcutaneous fat, which in turn indirectly affects the visceral fat as well. So with all these things, the fat reduction has been done. So after these treatments, the outcome parameters being BMI, fat, body fat percentage, visceral fat percentage, HbA1c values were taken. With all these values, before starting with the study, BMI fat percentage and visceral fat were measured using bioimpedance analysis machine. As I said, this is the Tanita machine we have used, and the Zeman software has been employed for this, which gives the clear picture of the patient's fat loss journey, and everything has been given in the next slide. So blood sampling, everything has been done, rechecked for the first 6 months. As this study lasted for 1 year, first results, first assessment has been taken in the 6 months. Soon after 6 months of this treatment, we have taken the first assessment, and in the end of the first year, we have taken the end assessment. So after this, the final outcome measures have been calculated, and this particular thing has happened. This is the progress analysis chart, which has been done by the Zeman software. As I said, bioimpedance analysis has been used. So with that, we got body fat reduction progress analysis is given on the chart. You can clearly visualize it. So here the date has been given, the end date has been given, and everything has been mentioned. Visceral fat is separately given, body fat analysis has been done, weight analysis has been done, BMI analysis is also present, muscle mass analysis is also there. So with these treatments we have observed the muscle mass has increased, the visceral fat has decreased, as the body fat percentage has also decreased. So with these treatments we have seen very good results, and with other blood work also we got to know that the results of this study showed that there is a positive impact of comprehensive approach in conservative management of obesity, that is the combination of diet, lifestyle modification in conjugation with the non-surgical weight loss treatments helped in the reversal of type 2 diabetes in recently diagnosed diabetic patients. In both type 1 and type 2, these treatments limited the adverse effects and further deterioration of diabetes, along with successful weight loss and improved quality of life. This was the end result which we observed using the study. With our study, we did in our clinic. So with this, I come to the end of this. Here are the references. You can see. So healthy and happy lifestyle, which decides how healthy you can lead your life, the quality of life will be enhanced. Everything lies in your hands, whether to be healthy or to ruin yourself. Everything lies in the hands of the particular patient or particular person. You are the master of your life and you are the one who has to decide it. So, your body is the reflection of your lifestyle. Stay fit and healthy. This is the final take home message I can give. Your body is the true reflection of your lifestyle. How you want it to be is decided by how you decide it to be. Stay fit and healthy. Thank you. I'm open for any questions. Dr. Himanshu, sir. Dr. Himanshu, sir.
Yes, sir. Thank you so much
Yes.
for a very insightful session.
Thank
And
you, sir.
we are really it was a very eye-opening session about the obesity management, and definitely the reversal of diabetes is possible as it is a lifestyle disorder. So
Yes,
ultimately,
sir.
the lifestyle modification is the key.
Yes,
And
sir.
your researches on this area are really great, man.
Thank you, sir. So I'm
If
open for questions.
yeah, yeah, if the participants has any query, they can write down their questions in this. There is one query like, can you please explain mesolipolysis?
Mesolipolysis. Mesolipolysis is something like they'll be giving the injections through which the fat loss can be obtained. That particular technique is outdated. Now they are not using that, but still, it is a technique by which mesotherapy, mesolipolysis is done by mesotherapy technique. Um, that gives very minimal weight loss in a particular area. I cannot see any significant weight loss with mesolipolysis. So it is a technique given for like double chin treatment and other things, but it is not significantly useful for overall body treatments. But it is a kind of technique I just mentioned. That's it. Mesolipolysis is more useful for double chin or any other small parts. Body contouring thing. Body contouring. It's also for smaller areas, not for bigger areas. Now, unlike for tummy or upper limb or lower limb, it is not that useful.
Thank you, ma'am. Thank you so much for the nice explanation. And I can see there were many participants joined and their interaction in the comment section.
Oh, very
All
good.
the participants who have joined the session,
Mhm.
they will be getting their e-certificates on their email, whatever they mention while filling the registration form. So please be in touch. Don't worry, everyone will get the certificate. Anyone else, if have any query, they can definitely write down in the comment box in the YouTube, and we will be very happy to answer the questions. Till anyone ask a question, ma'am, I have a query if allowed.
Yes, sir. Sure.
It was really like a mind blowing session and eye opening for me.
Sir.
While presenting your case, you told like you have selected the age group of 35 to 40. So, is
Yes,
there any
sir.
specific reason for this?
Sir, as we know, type 2 diabetes is seen only in the adults, sir. So 35 above cases are very few. I can see most of the people are around the age of 40 to 45 years of age. So 35 was the least mark I have seen. I had only 5 patients of 35 years of age, sir. Most of them are in the age group of 40 to 45. And as our criteria is that recently diagnosed patients, I had to take this particular age group.
Okay, okay, that's great, ma'am.
Yes, sir.
Actually, nowadays we see more like obesity is going to be common in the like adolescents.
Yes,
So
sir.
that's why I just asked, like we are going to become a diabetic capital. I think soon we will
Yes.
become like obesity capital as well. So,
Already we have become, sir.
oh,
Already we are there in that.
yeah.
So the most important thing is like our inclusion criteria was like they must be recently diagnosed with diabetes. So that was the reason we had to choose that age group, sir. Few of them in even after 50 years of age, those who lived actually a very healthy life, they were non-diabetic. So that age range was extended till 65. I had around 3 patients around the age of 62. They were recently diagnosed with diabetes around the age of 62 till 62. They were not diagnosed with diabetes mellitus.
Thank you, ma'am. Thank you for the great answer. I would like to invite Professor Dr. Himanshu Sharma sir for the vote of thanks.
It's a great session, ma'am. Uh, One question from my side also, that
Sure, sir.
your protocol was very convenient to every person,
Yes, sir.
even it is on the higher age also.
Yes, sir.
So, is it good for that we are going for that for the early age people? It will help or not?
Definitely, it will help, sir, because these are US FDA approved protocols, and every single person is having a unique protocol, which will be suitable for that particular person or for that particular health condition. So, for this particular health condition, like diabetes, along with obesity, which is by default having the fatty liver, we can use these two protocols. The other protocols might not be helpful to them. So only these protocols will not harm them and actually benefit them. That is the reason why we have chosen these two.
So we have to go with slow extent for these people because these are comorbid or diabetic patients are more vulnerable for the other conditions.
Yes, sir.
So this is the good option to have or go with the patients.
Yes, sir. Yes, sir.
Okay, okay. So this was a great session, ma'am, and primarily, as of Himanshu sir says that it is an eye-opening session, eye-opening
Thank you,
session
sir.
for everyone.
Thank you,
So
sir.
we'll be in touch, and we are grateful from the side of Physiotherapy College, Gayatri, Swasthya, shikshan, sansthan to you and the Physio Inculcators who make this event happen. And we are grateful to both of you. And
Thank you so much, sir.
we'll be in touch with you and ma'am, you and sir with in future. So
Sure, sir.
it's a great pleasure.
Thank you. Thank you so much, sir.
Thank you.
Thank you so
Thank you
much,
so much.
Himanshu Sharma, sir, and Himanshu Sharma, sir, both. Thank you so much.
Thank you, ma'am. Thank you
Thanks
so
for
much.
giving the best opportunity. Thank you.
Thanks. We are really grateful for your time and efforts,
Thank you, sir.
and hope to see you
Thank
again
you.
and again with many
Yeah,
Certainly.
as
accolades of
soon as
learning. Yeah.
possible.
Sure, sir. Sure. Thank you.
Thank you. Thank you so much.